Now here with all the answers to your medical questions, Dr. Msonthi Levine. Doctor, thanks so much for being with us today.
Appreciate it.
You staying dry today?
I'm trying to. It's hard.
How about broccoli sprouts? Never would think about that. That's quite the find.
Yeah, it's not really a surprise to me with everything that I see and read in terms of being a physician and read about just nutrition out there, health, the pharmaceutical industry, etc. Food is medicine, and medicine can be derived from eating proper food, real food. We talk about that a lot here on the show in terms of prioritizing vegetables in your diet and fresh fruit because they have a lot of healing properties in that food, especially when it's eaten fresh. Unfortunately, we rely a lot on processed foods here in America, and a lot of that processing destroys the nutrients, destroys the vitamins. There's a lot of smart people out there, a lot of argument out there talking about this situation and that it is contributing to a lot of the illnesses that we treat every single day. We all know about diabetes and heart disease, but psychological problems as well, depression, anxiety, schizophrenia, that the food that we eat, the sugar that we eat, influences the production and the symptoms of, in terms of these psychiatric illnesses. So it makes sense to go get back to your roots and get back with eating the broccoli, the kale, the fruits and vegetables. So it makes sense to me, no question.
Yeah, sometimes it's better, easier said than done to be able to eat like that, but yeah, you're absolutely right.
Yeah, you know, it's a big argument these days. It tends to be a little bit more expensive, absolutely. There's a little bit more legwork in terms of preparing that types of food. But again, if you're ill, if you're sick, it will cost you in the long run. A lot more typically. You know, we don't spend that much on food. You know, we used to spend most of our income on the food that we ate. We cooked it at home. It's the exact opposite now. We don't spend as much money on our food. We don't cook it at home. It's fast. It's a lot of times cheap, but we do pay a heavy price in the end. So we want the listeners and the viewers to understand that the base of your health is proper food and healthy food, so try to get on track with that.
Brothers talked me into a juicer, so I'm getting all fired up about that. Here's a question for you, Doc. I have a knee that constantly swells. What can I do to decrease this? Is there anything I can take or do besides going and having it drained?
Swelling typically indicates some sort of inflammatory response. A lot of times it's overuse or misuse. If you're running a lot, if you're doing certain activities that micro-injure the knee, you can try anti-inflammatory like Motrin, Advil, Aleve. A lot of times we'll start off with some x-rays, maybe even progress to an MRI. You might need a drain. So swelling indicates inflammation, injury. Don't blow that off. Certainly get an evaluation by a healthcare professional.
And quickly, this one here, how to treat PCOS. Tried to conceive 4 years ago, for 4 years and no luck.
Polycystic ovarian syndrome a lot of times comes about when you can't conceive. We use a medication called metformin and a medication called Clomid. Certainly you have to see a fertility specialist for further details.
All right, we'll be back with more of your questions in our Ask the Doc segment right after this. We are back with Dr. Levine to answer more of your medical questions today. Let's go to this one here from Melda. I had my right thyroid removed. I have hypothyroidism. What can I expect while I lose weight?
Hypothyroidism means the thyroid is not working at its peak or maximum. A lot of times we can pick that up on laboratory work, TSH and a free T4. Probably the thyroid was removed maybe because of a thyroid nodule or a malignancy. But a lot of times we can easily check that in the office, and we have good medications including Synthroid, which is a name brand, as well as levothyroxine, which is a generic, and we can easily titrate the medicine up or down based on symptoms as well as the results of the laboratory work. So typically you don't have to have a hypothyroid issue after surgery as long as you get proper replacement, go to your healthcare professional and get that adjusted.
So once you're on thyroid medicine, though, you never come off, is that correct?
Typically not. Just it may depend on the reason you develop the thyroid disease, but most of the patients who have thyroid illnesses, yes, they will have to stay on the thyroid medication. It's very easy to treat, and the medicines are well tolerated, and with the generic levothyroxine, some experts don't like the generic, but it is very affordable. We easily can typically treat this illness.
From Lois, I have a lot of leg pain, but no matter how much I exercise, the weaker they become, even to the point to almost folding under me. I'm not overweight. The pain is two ways. Shooting pains from my hips to my lower leg. However, there's a constant pain in my knees. What could be the problem?
A lot of times we will see either a problem with the spinal stenosis or narrowing of the spinal area in the back related to degenerative joint disease. It pinches on the nerves, and when you walk or try to exercise, the nerves get irritated, they don't work, and so they produce pain and weakness. The other thing I would consider is poor circulation. We talk about that a lot on this show just because of the cardiovascular issues in America, again, related to diet, lifestyle. A lot of times the circulation is just not enough to supply blood flow to the muscles, and so when you walk or you exercise, the muscles are just crying for blood and they can't work, and so they become weak. And again, the pain can come from both of those issues. We can normally work that out with an MRI of the back or a circulatory test such as an ultrasound or a CTA or an MRA. Again, we both have good therapies for both of these issues.
Okay. A 66-year-old woman says, can people be allergic to insulin?
I think people can be allergic to anything. I just don't see it that often. We do come across people like that rarely. That's a very tough situation to try and convince a patient that they need the insulin, but they feel they're allergic to it. So we don't come across it that often, but we see it periodically.
And last question, 53-year-old female has a huge bruise on her leg, but she hasn't hit or bumped into anything. What could be causing this?
At 53, this is normally a benign issue, but certainly some laboratory work is due. CBC, a PTI in order to check the blood clotting levels. A lot of times this is just spontaneous bleeding that some people get as the skin ages, as the circulatory system ages. And it's worse if you're on aspirin, Plavix, or medicines like Coumadin.
Okay. Thank you, Dr. Levine.
Yes, sir.
Again, terrific insight. Have a great week.
I will. Thank you.
We can always visit our website and see the answers to these and other medical questions posted online. If you want to have Dr. Levine answer your medical question, you can always mail us at the address listed on the screen, and you can fax us at 892-7305 or email us at live@5@kfdm.com.